Okay, before I begin, can I start with your name and your date of birth, please?
Darnell Pratt, 12/22/1986.
And do you consent to being recorded during this video?
Yes.
So you're 18 or older?
Yes.
All right, so gonna get started here. My name is Rainisha. Today I'll be doing a head to toe assessment on a client. So I've already checked my doctor's orders. Prior, I will come provide my client with privacy, perform some hand hygiene, and I would then proceed to knock. Hello, my name is Rainisha. I'm your student nurse today. I'm here to perform a full head to toe assessment. Um, upon your arrival, can I start with your first and your last name and your full date of birth?
Darnell Pratt, 12/22/1986.
All right, Darnell Pratt, 12/22, 1986. All right. Can you tell me how you feeling today, Darnell?
Feeling good.
All right. Are you in any pain on the scale from 0 to 10, 10 being the worst pain you felt?
No pain.
All right. Do you have any allergies to medications, food, or anything? Latex?
No allergies.
All right. So I'm going to start off with a couple of questions here for you, Darnell. Can you tell me where you are today?
Syracuse, New York, inside a living room
Can you tell me why you're here today?
for a full body assessment.
All right. Can you tell me what you had for breakfast today?
A bagel and orange juice.
All right. Can you tell me where you were born?
Camden, New Jersey.
All right. So my patient is alert and oriented times three. His mood and affect is a congruent for today's appointment. He also is um, dressed well for today's appointment. I see no signs of distress. His hygiene is good. His posture is upright and erect. All right. And his recent and remote memory are also intact. So now I'm going to get started here. I'm going to perform hand hygiene once again. All right. I'm going to start with your cranial nerves. And it's 12 of those. So I'm going to get going. Can I have you close your eyes for me, please? And include one nostril, please. What do you smell?
Smell like gum.
All right. Can you do the same for the other? What do you smell?
Hand sanitizer.
All right. You can open your eyes, please. So cranial nerve 1 is intact bilaterally. So for cranial nerve 2, if I had a Snellen chart, I would have my client stand in front of the stand 20 feet away from the Snellen chart and occlude one eye and read the smallest font that you can read. And then so for cranial nerve number 3, 4, and 6, I'm going to ask for you to just look straight here. I'm going to check your pupils. All right. So now can you look straight to the TV for me, please? Straight ahead. All right. Now I'm just gonna bring my finger in and follow that. All right. I'm just gonna have you please follow my pen light with just your eyes, please. All right, cranial nerves 3, 4, and 6 are intact. Pupils are equal, round, react to light and accommodation bilaterally. Pupil size is about a 5. Also, I see no signs of any nystagmus. So now for cranial nerve number 5, I just need for you to close your eyes. I'm going to touch your face. You're going to let me know if you feel a sharp sensation or a dull sensation. Close your eyes for me, please.
Dull. Sharp. Dull. Sharp.
All right, you can open your eyes now, please. All right, now I'm going to ask for you to just clench your teeth together for me. I'm going to palpate your masseter here. Your masseter is equal bilaterally strength, 5 out of 5. Cranial nerve number 5 is intact. So for cranial nerve number 7, I'm just going to have you please smile for me, frown for me, raise your eyebrows for me, puff out your cheeks, please. All right, you can let your face. All right, cranial nerve number 7 is intact. I see no signs of any um facial drooping. So now I'm going to move on to cranial nerve number 8. So I'm going to go behind you and I'm going to whisper something in your ear. I need for you to clue one ear for me.
1, 2, 3,
Can you clue the other ear?
4, 5, 6.
All right, cranial nerve number 8 is intact bilaterally, no hard of hearing. So now for cranial nerve number 9, if I had um, a tongue depressor, I will have my client open his mouth and I will check his gag reflex. So cranial nerve number 10, I am going to have my client open his mouth and say ah for me, please.
Ah.
All right, so cranial nerve number 10 is intact. The uvula rises midline with no deviations to the left or to the right. Okay, you can close your mouth now. All right, so cranial nerve number 11, I want you to push against my resistance when I push your shoulders, please. Okay, ready? All right, can you do the same here? Push against my resistance. Same here. All right, cranial nerve 11 is intact bilaterally, muscle strength of 5 out of 5. So now I'm going to do cranial nerve number 12. I'm just going to need for you to open your mouth, please, and just stick out your tongue. Okay, so cranial nerve number 12 is intact. The tongue rises um, with no deviate midline with no deviations to the left or to the right. So now I'm going to move on to my patient's skin. So my patient's skin is appropriate for his ethnicity. I see no redness, no scars, no rashes, or any masses. So I'm going to now palpate his skin here. Any pain or tenderness?
No pain.
All right, the skin is clean, dry, and intact. It's bilaterally. The skin is also warm bilaterally. So then I will ask you to, I'm going to look at your bony prominences here, your elbow, your other elbow. I will look at your sacrum. And then also the back of each heel. So hand hygiene, the bony prominences. I see no ulcers, no redness, no openings, no drainage. So I'm going to move on to, I'm going to do your pulses here. So can you turn your arm? Yep. I am now going to palpate your radial pulse bilaterally. Radial pulses 2 plus bilaterally. I am now going to palpate your brachial pulse bilaterally. Brachial pulses are 2 plus bilaterally even. Can you turn your hands this way for me? Yep. I will check your skin Truger. All right, no tenting noted. The skin returns in less than 2 seconds. I'm going to now check bilaterally. I'm going to now check the cap refill. All right, cap refill returns in less than 2 seconds bilaterally. So, okay, now I'm going to assess your head here. General inspection, it's normal cephalic. Now I'm going to begin with light palpations. Any pain or tenderness?
No.
Any pain or tenderness?
No.
No pain or tenderness noted. No lumps, masses, lumps, or bumps noted. I see a full head of hair, full head of black hair, straight texture. Also, I see no infestations, no redness. All right. So down to your ears. So your ears are symmetrical bilaterally. Um, I see that the skin around it is clean, dry, and intact. The auricles are symmetrical bilaterally. I am going to now palpate the auricles. Any pain or tenderness?
No.
Now I'm going to palpate the tragus. Any pain or tenderness?
No.
All right. Now the mastoid. Any pain or tenderness?
No.
All right. No pain or tenderness noted bilaterally. I feel no lumps, bumps, or masses or lesions bilaterally. The skin is um, warm to touch bilaterally. Temperature is equal throughout bilaterally. Now to look inside. His ears are no buildup of cerumen, no discharge or any drainage, no redness noted inside of the airway canal. Um, it here. So now to your eyes. So the skin around your eyes matches my client's ethnicity. See, I see no scarring or bruising. I also, a general appearance, I see no signs of any jaundice. Now I'm going to just have you, I'm sorry, look up for me, yeah? All right, so the sclera is white bilaterally. The conjunctiva is pink and moist bilaterally. I saw no drainage, no redness. Okay, my client's nose sits midline. His nears are symmetric, symmetrical bilaterally. I see his skin around his nose is clean, dry, and intact. Now I'm going to palpate some. Any pain or tenderness?
No.
All right, so no pain or tenderness. His nasal septum is midline, no protrusion or deviation to the left or to the right. His nasal mucosa is pink and moist. I see no signs of any no signs of drainage or fluid or lumps, bumps, or masses. I don't see any redness. All right. Can I have you occlude one nostril for me, please? And take a deep breath in. All right. Occlude the other nostril. Deep breath in. All right. Client's nasal patency is good bilaterally. So now onto my mouth. Around his mouth, his color is appropriate for his ethnicity. Also, his lips are pink and moist. I see no cracking, no chappedness, no dryness. I don't see any signs of cyanosis. So now I'm gonna have you open your mouth for me, please. All right, his oral his his buccal mucosa is pink and moist. His oral mucosa is pink and moist. No signs of any exudate. He has all of his adult teeth, no cracks, no breaks, no cavities. Also, his gums are pink and moist. No redness or swelling. No signs of gingivitis. His hard and soft palate are pink and moist. He has no tonsils. Also, his tongue is midline with no deviations to the left or to the right. So now to your neck here, the color around is appropriate for his ethnicity. I see no, it's clean. His skin is clean, dry, and intact. Also, Can you hold your head up? His trachea sits midline with no deviations to the left or to the right. Now I'm going to palpate your carotid one at a time. Let your head up. With both eyes. Carotid, carotid pulses are 2+ bilaterally. Now I'm going to auscultate his carotid pulses with the bell. Breathe in. Right. His carotid pulses, no signs of any Rui bilaterally. Now I'm going to go down and I am going to assess the chest. So the chest um, is the skin color is appropriate for his ethnicity. I see no redness, no scarring, no bruising. I see some tattooing with the hip. It healed well. So now I would ask for you to stand up for me, please. Client's chest AP diameter is a 1 to 2. No barrel chesting here. All right. Now can you turn around for me, please? I'm going to place my fingers in the so your back here. Just checking your chest expansion, lung expansion. Now breathe in. Out. All right, my client's chest expansion is equal bilaterally. Now I'm going to see about your CVA tenderness. You're going to feel me tap back here. Let me know if you feel any pain or tenderness when I do this. Any pain or tenderness?
No.
I'm going to do the same on this side here. Any pain or tenderness?
No.
All right, no pain or tenderness noted, no CVA tenderness noted here. All right, so now can I just have you bend over some? Just any pain or tenderness here?
No.
All right, can you come back up for me? All right. So no pain and tenderness noted in the spine. Also, no signs of kyphosis, lordosis, or scoliosis. Can I have you just? I'm going to auscultate your lung sounds posteriorly here. Just when you feel my stethoscope, take a breath in and breath out, and you can breathe normal each time. All right, lung sounds are clear all throughout. No sounds of crackles, wheezes, or rhonchi. All right, can you turn that this way for me? Now I'm going to auscultate the anterior lung sounds here. Can you just breathe same way when you feel my stethoscope? These 8 spots. Good. Right? Lung sounds are clear throughout. No signs of No signs of crackle, wheezes, or rhonchi in the anterior lung lobe sounds. So now I'm going to move on to auscultate my respiratory sounds here. So breathing is non-labored, regular breathing. So I'm going to go forward here. You could just breathe normal for me. I'm gonna listen to your heart sounds here. So in the second right intercostal space, this is the aortic here. The second left intercostal space, this is the pulmonic. The third left intercostal space, this is the Erb's point. Fourth left intercostal space, this is the tricuspid. The fifth left intercostal midclavicular line, this is the mitral, also where I will listen for my apical pulse for a minute here. The heart signs was S1, S2 throughout. No signs of murmurs, rubs. So now I'm going to have for you to, with the same, I will also listen with the bell and those same landmarks, with the bell of the stethoscope and those same landmarks, for any murmurs and low pitched sounds that I can't hear with the diaphragm of the stethoscope. So now I'm going to ask for you to sit down, please. Perform your hygiene here. You can lay back for me, please. So, all right. I'm gonna ask you a couple of questions. When was your last bowel movement?
This morning.
Is that regular for you?
Yes.
All right. Do you have any trouble starting or stopping your stream, your flow?
No.
All right. I will ask if you was pregnant or you're a man. So, all right. So, the abdomen is flat, no protrusion. The color matches my client ethnicity. I see no redness, no scars, no scars or no redness. I see no incisions along the stomach. I also see the umbilicus is midline with no signs of any hernias. Excuse me. All right. So now I would then come over and I will auscultate with the diaphragm of my stethoscope and listen for the vowel sounds here. And I will start in the right lower and work my way around clock. Right upper, left upper, left lower. All right. Vowel sounds are normal throughout all four quadrants. No signs of hypo or hyperactivity. Now I'm going to palpate, soft palpate, light palpate, sorry. All right, can you let me know if you feel any pain or tenderness here? Any pain or tenderness?
No.
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 All right, I'm gonna do the same again, but a little deeper, okay? Any pain or tenderness?
No.
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 All right, no pain or tenderness noted. Also, I feel no lumps, bumps, or masses or anything protruding that any protrusion in the abdomen. So now I'm going to have you sit up for me, please. Now I'm going to inspect your lower extremities here. So your skin and your lower extremities, they match your ethnicity. It matches ethnicity. I see no signs of redness or any open lesions, rashes, masses, or bumps. Now I'm going to gently palpate here. The skin is clean, dry, and intact. It's warm to touch bilaterally. I feel no edema. He has hair distributed evenly throughout. Now I'm going to, any pain or tenderness here?
No.
No pain or tenderness noted. All right. So now I'm going to ask for you to, I'm going to come down here and I am going to assess your dorsalis pedis bilaterally. All right, 2 plus bilaterally. Then I'm going to assess your tibial interior pulses bilaterally. 2 plus bilaterally. Then I will assess your cap refill. Cap refill returns in less than 2 seconds. Bilaterally. All right. So now can you... All right, so now I am going to assess your range of motion down here. Can you take your foot and can you plantar flex it, dorsiflex it? Yep. Now plantar flex it. All right. No crepitus noted here. Full range of motion in his ankles. Can you do the same here? Dorsiflex, plantar flex. No crepitus noted. Full range of motion in his ankles. Okay. Can you, excuse me? Can you muscle strength here? No, toes to your nose. All right. Push the pedal. Toes to your nose. Push the pedal. All right. Muscle strength is a 5 out of 5. All right. So now can I have you extend your legs. Hyperextend now. Bring them down. Bring this up. No. Lift your, yep, knees to your chest. Knees to your chest. All right, no crepitus noticed bilaterally. Muscle strength 5 out of 5 here. I'm going to check your deep tendon reflexes here. Okay, deep tendon reflexes are there. All right, so now I'm going to have for you to stand up. All right, can you extend, abduct, I'm sorry, adduct, flex, extend, hyperextend. All right, so full range of motion without any pain or tenderness in the upper extremities, 5 out of 5. Can I have you put your hands like this for me? Don't let me push, don't let me pull. Oh. Yeah. All right. Muscle strength 5 out of 5 bilaterally. So can you turn around? Can you bend over some? Come on up. All right. Can you twist? No. Oh. All right. Raise your shoulders. All right. Any pain or tenderness?
No.
All right. Muscle strength 5 out of 5. Full range of motion. No crepitus felt in the shoulder blades. Now I'm gonna ask for you to turn this way. Can you take a straight walk for me? Turn around, walk back. Mm. All right. Client's gait is good. Posture's straight gait. I'm gonna ask for you to stand. Close your eyes. All right. Client's Romberg is negative. All right. You can take a seat for me. All right. So now I'm going to perform hand hygiene. Do you need anything before I go?
No, ma'am.
Well, put your call bell with you. If you need anything, let me know. You can call for me. I'm going to lower your bed, put the brakes on your bed, and hand hygiene and document my findings.